Hey there YouTubers, welcome back to our channel. I'm Dr. Preston Nguyen, and today we'll be discussing one of my favorite ways to stretch the hip flexor muscle group and the surrounding tissue. But first, like our video and subscribe to our channel. If you found this video helpful in any way, please feel free to donate. Stretching your hip flexor is appropriate for those who sit a lot, have chronically tight hip flexors or quads, or anyone with just a tight abdomen to lower quadrant region. Your hip flexors essentially help you bend at the hip or bring your legs up towards your chest. They are often tight due to increased sitting, where they are maintained in a prolonged shortened position. There are 3 variations of this stretch that you can choose from depending on where your restrictions are and in what capacity you can perform this stretch. The main points to emphasize are maintaining a neutral and stable pelvis and preventing hyperextension of the lumbar spine. So let's get to it.
So there are 3 ways to perform this stretch. The first one we would do in a standing position. So we're going to take a half step back with the leg on the side that we are performing the stretch. Okay, we're going to have a slight bend in the front knee. This knee, depending, can either be straightened out or slightly bent. And you're going to push that leg into the ground. You should feel a stretch here. If you don't, that's okay. You can add a little bit more by lifting up this arm and breathing into this lower right abdominal area. So you just hold this for about 30 seconds to a minute and breathe into it. Key points here are to again maintain that neutral pelvis and prevent yourself from hyperextending that lumbar spine too far. A little bit of extension is okay if you really need to feel that stretch. Just prevent yourself from leaning too far back. Okay, the second way we're going to do this exercise is in a half kneeling position. Here you're going to want to use some type of pad, carpet, a pillow, a foam pad, just to take some pressure off the knees. You're going to kneel down with the knee on the side that we're stretching. You're going to push that knee into the foam pad, stabilize the pelvis. You can use a little bit of a lumbar extension here if you need to, just avoid overarching or hyperextending. You can lift up this arm to add a little bit more of a stretch and breathe again into this right lower quadrant. If you aren't feeling this stretch, you can push that knee down. Just make sure you're maintaining that stable, neutral pelvis. Okay. Good. Okay. And then from the side, it's going to look something like this. This one you can really see that pelvis. I'm not extending my lumbar spine too far back. Driving that knee down into the foam pad, lifting that arm, and just taking some deep breaths into this part here. Okay, again, you're going to want to hold for about 30 seconds to a minute. The third one here, we're going to want something that you can sit on, edge of a table, a stable chair. Unfortunately, we just have a rolling one. I would not recommend you perform this on a rolling one because you might slide a little bit. So one leg's going to be in front here. The one that you're working with is going to be slightly behind and in a bent position. And all you're really going to do is let that leg come off, push it into the ground with your toe, and you're really going to feel that stretch across the front here. Again, if you want to add a little bit more of a stretch, you can raise that arm, breathe into the area. I really like the seated position because we do sit a lot. And in a seated position, your pelvis is going to be stable for you, so you don't really have to worry about stabilizing that pelvis. And it's a little hard to hyperextend your back in this position, so this one's probably the safest for you to do. Okay, I'm just going to turn to the side so you can see what that looks like. Okay, there you go. So you can see my neutral pelvis. I'm not hyperextending my back. I have that arm up so I can get a little bit more of a stretch on that whole right side, and I'm breathing into that right lower quadrant.
And there you have it. You now have multiple ways to stretch out that hip flexor muscle group. If you're still experiencing chronic hip flexor tightness, the cause could be more than simply a hip flexor problem. Check out some of the videos on our channel or seek out help from a professional healthcare provider. Again, I'm Dr. Preston Nguyen, and we can and will get better together.